My name is Jennifer Lanzer. I am a physician. I am a urogynecologist, and I work here at Northeast Georgia. So as a urogynecologist, I specialized in treating pelvic floor disorders. So that can include things like urinary incontinence, pelvic organ prolapse, fecal incontinence, as well as some bladder disorders, things like recurrent urinary tract infections, interstitial cystitis, which is a painful bladder syndrome, as well as even things like fistulas and urethral diverticulum. So I was very fortunate to be born into a medical family. My grandfather was an internist in the Atlanta area for decades, and he had a small private practice. My grandmother ran the front office, so she would babysit me all the time. So literally my first toys were stethoscopes and tongue depressors. And so I just idolized my grandfather and always knew that I wanted to be a doctor. But my mom was a nurse, and she did labor and delivery for years. And so, what we always hear about at the dinner table was women's health issues and things like that. And she, I think, really gave me my passion for women's health. So pelvic floor disorders encompass, many complaints. Urinary incontinence, pelvic organ prolapse being the most common. And these are things that every day I have a patient come to me and they say, I didn't know that I could develop prolapse. Nobody ever told me about that. And what I can reassure patients and say is that this is extremely common. It is a treatable condition, and it's something that women just don't talk about, or maybe just in whispers or things like that, or hear maybe your mother dealt with it. But I think a lot of these conditions, that this is what I am here for, and this is what I treat. And even though women don't talk about it very much, we are trying to raise awareness. We're trying to let women know that having to wear Depends and diapers all the time is not just a normal part of aging. There are many interventions that we have available to really improve quality of life. Since I have been here, I have been so impressed with Northeast Georgia's commitment to this community. I think that, they are not just in the business of making money. They are in the business of really, as they say, improving the health of our community. I think that is a mission that has been drilled into me as somebody who's just getting started here. And I think that's very much an alignment with how I want to practice. I want to have an impact on patients' health, and I think that this is a hospital system that is very much in line with that.